Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of. Well, I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Kelly Owens, and not only is she a trauma-informed care specialist, but also a yoga instructor and also works in the nonprofit sector. Kelly, thanks for being here today.
Thanks so much for having me, Robin.
So we're talking about some unique research that you've done about yoga and therapy. Tell us about it.
So as someone who has received some trauma-informed care myself, I realized the necessity for it, particularly in medical settings. Many people come into a doctor's office with a lot of past trauma or negative experiences, and that is going to influence things like test results. White coat syndrome is very, very real. When you take someone's blood pressure, if they're anxious about having their blood pressure taken, it is typically going to go up, and it's not giving their healthcare practitioner an accurate picture of what's going on with their body. And having a trauma-informed perspective in a healthcare setting can be profound, because not only are you going to build a relationship with the person that you're serving as a medical practitioner, you're going to build trust. It's also very literally going to affect their test results and the way that you respond with treatment. Again, so many people have negative experiences with doctors' offices. I know that I have in the past. And that was one of the reasons that led me down this path. Also, a lot of the research that I did while I was at the Clinton School for Public Service in my first year program design and evaluation class had to do with yoga, specifically as a treatment for high ACE scores. But it is something that is very applicable to many aspects of life, very applicable to doctors' offices, medical practitioners. And I got a lot of my experience during that work through a wonderful nonprofit called Prison Yoga Project, where I was actually able to go into the Pulaski County Jail and teach yoga to large groups of individuals who were incarcerated at the time, and it was a very profound experience for me. It was probably the best experience I could have as someone who wants to take that trauma-informed perspective into everything I do professionally, but also as a yoga teacher. I think that individuals who are incarcerated have experienced a wide array of different traumas, and it was a very profound just pleasure and opportunity for me to serve that group of people.
If you have a high ACEs score, an adverse childhood experience score, it's important to understand what's going on with your body. And is that something when you should know what your score is, and when you go in to see your physician, you need to let them know, that way that can kind of affect their choice of care or plan of care?
Yes, I think it's wonderful to know your ACEs score before you go into a doctor's office and be transparent with your doctor about the ACEs score, as well as being transparent about any medical trauma that you may have had or any trauma. I know that individuals who have experienced sexual assault may have an intense visceral reaction to being touched. That is something that needs to be disclosed, but I also think it's important for practitioners to know what to look for. If you're having someone come into a doctor's office and they're presenting with a wide variety of somatic symptoms that aren't necessarily obviously correlated or connected, I think a gentle way to ask that is there something significant or stressful that's going on in your life right now? The answer to that might be no, but it opens the door to have a conversation where an ACE screening might become an appropriate thing to do. I think that it's important that practitioners pay attention to those psychological cues. Again, there is a concept, it's called alexithymia. It's an inability to understand the feelings that are happening in the body. And when I spoke recently at the AFMC conference, one of the things I said is the question, where are you feeling that in your body, comes up in two places. Oftentimes in therapist offices, it can also come up in yoga classes. And as I'm not a licensed therapist, I'm not a doctor, but as a yoga teacher and someone who's experienced this personally, as someone with a high ACE score, oftentimes people don't know how to answer that question or even what it means. You might as well be speaking in a different language. If that happens, if someone cannot explain what is happening in their body, that can be an indicator to a practitioner that maybe an ACE test, an ACE score, is an appropriate measure, because alexithymia, while it can be related to other healthcare conditions, it can be related to mental health conditions, it can be related to autism spectrum disorder, but it's also very common in people with PTSD and CPTSD. There's a protective mechanism where the brain and the body really stop communicating at some point in time. Yoga is a great way to reinvigorate that system, to reconnect it. It takes time. But if someone is, again, having somatic symptoms that are not necessarily correlated to test scores that are happening in a doctor's office, it might be appropriate to ask the question, where are you feeling these big emotions in your body? And if that's a difficult thing to answer, I think it's always good for practitioners to have referrals ready to go to therapists, maybe suggesting yoga, things that can recreate that mind-body connection so that people can develop a language to even tell their doctors what's happening in their body.
And your research really kind of dives into that, is for not only the patient, but the provider to be able to kind of tune in and know where to go from here and how to assess that. Is that right?
So my research was based primarily on an implementation for school use. So working with children in areas where it can be assumed that these children are going to have high ACE scores as adults. And just as an aside about ACE scores, it's really a test that should be taken over the age of 18. If you're looking at a group of people who are likely to have had these traumas, it's great to start with kids developing that language now, so that as an adult, they don't go into a doctor's office and have alexithymia, because they've already created a language and a connection between the mind and body, even through difficult things. So that's why for that implementation, I focused on kids. An early intervention is always best. It doesn't matter what the intervention is or what the issue is, an early intervention is always best. However, this is still something that an adult can cultivate as well. Again, more difficult, definitely not impossible. And if a practitioner is willing to make referrals, again, to a good trauma-informed therapist or a good trauma-informed yoga teacher or class, that can start the process.
So tell us what breathing practices are, because there are some things within yoga therapies that can help. What is a breathing practice?
So breath work is, I think, one of the most important components of yoga. And when people hear yoga, they think automatically about what we call the asanas, which are the poses. Many of the poses are actually relatively new inventions dating back to the 1900s. Some of them are more ancient, but most of them are relatively new. Breathing practices, however, are ancient. They are ancient practices. And I think that looking to the wisdom of the ancients, much of which we have forgotten in our modern culture, which is very fast-paced, it takes you back to the basics. We think, well, I take that back. We don't think much about our breath. Most of us don't think anything about our inhales and our exhales unless we have some kind of fitness tracker. Our oxygenation levels might not even be something we're concerned about. But breathing practices are something that anyone can do at any time. And I really recommend them for a doctor's office. If you're having someone who's having white coat syndrome and super high blood pressure readings, the first thing that I would recommend, assuming they're comfortable with this, is to ask them to take their shoes off. Some doctors are going to do this anyway if they're looking for indicators of diabetes, but if they're comfortable, put down some paper towels on the floor, ask them to take their shoes off and set their feet flat on the floor. Sit in their chair, assuming this is comfortable, without resting against the back of your chair. This enables you to really feel more so what's happening in your rib cage, because it's your body is freestanding at this point in time. To really ground yourself on your chair, and having the feet flat on the floor helps with that. Sitting up straight, so creating a good open vessel for the breath. And one thing that I really encourage people to do is what I call box breathing. I like to tell people to envision a square in their mind, and to inhale up one side of the square, to hold across the top, to exhale, and then to hold. And it's called a 4-part breath. If 4-part breath feels overwhelming, envision a triangle and just try a 3-part breath, which is an inhale, a hold, and then an exhale. I encourage people, this is something that nurses or doctors can do to get more accurate readings, to make people feel more comfortable. I've actually done some work with the Miss Arkansas contestants, and this is what I told them to do. If you're getting nervous, no one has to know that you're doing box breathing or triangle breathing, but the idea is to create space between the inhale and the exhale, which we forget to do in our modern world, which is very fast-paced. That is going to signal to your brain and your body that everything is okay. Because when we're panicked and when we're consumed with anxiety, our natural bodily response is to prepare for fight, flight, or flee. And that means we're going to be taking in, inhaling, and exhaling as much as possible. So this is really a practice where the nervous system follows the breath, as opposed to the breath following the nervous system, which is what is happening when there's anxiety. So backing up, reversing the system, creating space between the breath, making sure that those lines are equidistant. I also think when you walk into a studio, one of the things that we typically try to do is minimize light and sound. For people with certain health conditions, people with trauma, that can be a good thing as well in calming them down. I've seen in a lot of doctors' offices recently, there are dimmer switches. Sometimes a lot of light and a lot of sound can be super overwhelming. And again, that you're going to get that automatic nervous system response. If you know that you're dealing with a patient who might have white coat syndrome, who might have medical trauma or some other kind of trauma, maybe try turning the lights down a little bit, even before they enter the room, just so that their nervous system can get that cue that, okay, this is a peaceful environment, we're not overstimulated. And then trying that box breathing. Another thing with people with alexithymia, when you ask, where are you feeling that in your body? Where is that symptom coming from? A lot of people feel like when they have trauma that an inability to answer that question is a wrong answer, and that's very upsetting. And when you ask it as a question, like, you should automatically know the answer to this, because maybe someone with trauma would be able to verbalize that. It's going to create a secondary emotional reaction. So I think it's also important for practitioners to say, hey, it's really okay that you don't know how to answer that question. Let me give you some skills and some resources so that you can get more tuned in with your body. And I think that that's a great way to sort of bring the nervous system down before you're even diving into the medical components of an exam or a conversation.
Well, Kelly, thank you for going through this important information that's so applicable in so many ways, even outside of a doctor's office, that we can take with us, even do in our car, at the desk, at home, anywhere, but also really great information for healthcare providers. Thank you.
Yeah, of course. Thank you.
And that's it for this episode of AFMC TV. Thanks for watching and have a great day.